Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe, and I'm proud to be your chairman. And part of my duties, and the biggest part of my duties, I would say, is to protect the well-being of the Lumbee people and to protect the Lumbee way of life. And in doing so, we produced a video just last Saturday talking about this coronavirus pandemic. And during that video, I stated that I had self-quarantined and had been tested and had received negative results on March the 18th. So since our last video, there's still rumors out there that I tested positive or I'm still awaiting test results. Both are which untrue. Just as recently as yesterday, from a newspaper out in Cherokee County in North Carolina called the Carolina Public Press, has a article online talking about tribes across Carolinas hunkered down to endure coronavirus pandemic. And this article was written by Joseph Martin. I never talked to Joseph Martin. I was not interviewed by him or the newspaper. Apparently he got his information from our video just last week. But during his article, he says that Godwin announced through a video on the Lumbee's Facebook page Saturday that he had been tested and was awaiting results. This is false reporting and it's untrue information, and we have contacted the newspaper and we're awaiting a response for them to correct this error. And then in my way of looking at it, almost an injustice, because what this does is cause fear and panic, not just among the Lumbee people that I've been walking around since March 19th, but many other people as well. So once again, I just wanted to set the record straight for my personal health and assure all people, in particularly the Lumbee people, that what you've been hearing is untrue, and we just want you to have the facts. It's unfortunate when people take the truth and turn it into a lie, but that's the world we live in today. But on a brighter note, today I have with me here at the Erie Lowry Homestead, Dr. Chamaine Brooks-Locklear, my personal physician, by the way, and also the wife of Harvey Godwin of Locklear Farms, the owner, who helped us start the Lumbee Garden Night here at the Culture Center, and has helped us with it and guided us through every season, and he's going to guide us through this one as well at the end of this pandemic. So, Dr. Chamaine, I would like for you just to tell the people what is social distancing and how do we need to perform it, and why is it important for not just our people, but all people across the world?
Well, we're living in an unprecedented time, and specifically here in North Carolina, we've seen the increased numbers of COVID go from 1 on March 3rd to 935 as of today, March 28th, with 87 patients in the hospital. We know that in the United States there's over 100,000 cases of COVID-19, and I'm seeing a lot of questions in the public about what is this coronavirus, and is it really that different from influenza? And I'm just here to share with you a few facts about coronavirus. So coronavirus already was something we know of and was already a respiratory illness. It's just this time it's a brand new strain called COVID-19. So it's a brand new strain that we first identified in China a few months ago. And now it's spread worldwide. It's considered a pandemic, so it landed in the United States in January. This coronavirus is much different from the flu in that it makes you much sicker than the flu. It has a higher transmission rate, meaning it's just much easier to spread from person to person. It's a longer illness with a longer incubation period, so you may be carrying the virus for many days, potentially 14 days, before you ever show signs that you may be sick, which means during that time period you could spread it to someone else. It also lives on surfaces a lot longer than the flu. It lives in the air for a few hours. It can live on cardboard or paper or metal, actually for days. The other thing that makes it different is that there's no immunity to this coronavirus. It's new, it's novel. So there's no vaccine, there's no herd immunity, there's no specific treatment. And so for those many reasons, we're seeing that there's a higher mortality from coronavirus than influenza. Influenza causes about a 0.1% fatality, meaning death rate. But this coronavirus, depending on the population or country you're looking at, ranges up to 4%, which is a big difference. It's phenomenal. We know that the symptom onset from the time you get coronavirus is averaging about 5 days, but it may take 11 to 14 days before you actually show signs that you're sick. There are many people who have a common cold, like head congestion, sinusitis symptoms. A lot of people have a common chest cold or even pneumonia. And we're thinking about 70 to 80% of people with coronavirus are able to be treated at home, meaning you stay at home, you do not need to go to a hospital. But the statistics now are showing 20 to 29% of patients are needing to be admitted to the hospital. Again, this is much higher than influenza. And then a large percentage of those patients will need critical care in the ICU. Again, unprecedented. These numbers mean that we're going to really overwhelm our healthcare system. Our hospitals are already near capacity of heart failure patients and pneumonia patients, stroke patients, you name it. And now on top of that, we're not going to have enough beds for patients with coronavirus. We're seeing this in many other countries. So we're learning from China, we're learning from Italy, South Korea, what's going on. And week by week by week, as the numbers exponentially increase, we're seeing that more and more people will need to go to the hospital. Our goal in the United States, specifically North Carolina, is to try to prevent this. And that's why we use the word flattening the curve and social distancing. So the goal is that since we know that the many factors of this virus show exponential growth, we need to do something to prevent that growth. And that's not what doctors do, that's what each individual person and family does. And that's called social distancing. Our goal is to really limit close contact with people at a minimum, and of course wash your hands as frequently as possible so that way we're not spreading the virus unknowingly. And so the governor and our secretary, Dr. Cohen, has had several press releases trying to encourage our North Carolina citizens to participate in social distancing. Now it's actually an executive order as of this coming Monday, okay, where we will be forced to make sure we're staying home. If we have to go to work, we go to work. If we need to go to a doctor's appointment, if we have to go to the pharmacy, if we have to go get gas, go get necessary food and grocery items, we can do that. But we're not to hang out in social crowds. We're not to meet up with family members and visit just to visit. We're not to hang out at the gas station close and socialize with people at the stores. We are to really limit interacting with people and keeping a 6-foot distance between others. It's really hard because it's out of our nature to do this. I'm having to remind myself at work to keep my distance even from my nurse and my other staff in my office, because we really need to keep the 6 feet parameter so that way we're less likely to spread the virus. And it's necessary for really everybody to do their part. We can't have some families taking this serious and other families not taking it serious, because if we don't, we're only going to see the numbers increase. By tomorrow, we're going to have 1,000 known coronavirus cases in this state. And that's many more other likely cases that are not known because we're not able to test everyone. And so the thinking or mentality should be, number one, you never know who around you may have the virus. And number two, you may be having the virus and just don't know it yet. So you don't want to spread that to someone else. You don't want to go visit your grandma just to check on her if she doesn't really live with you and she doesn't really need to be checked on. So we really need to be very mindful of our social habits this next month or so. And it may potentially go on further. We'll have to wait and see. But our goal is really to preserve our healthcare system and make sure that when we need it, when your mom gets sick, when your dad gets sick, be it from the coronavirus, be it from sepsis, be it from having a heart attack, when you need to go to the doctor at the hospital, there's a bed for you at the hospital. There's a bed for your family member. And we may think that it's not really close to home because it's not that bad here in North Carolina, although there's 87 admissions in North Carolina. But we can just look at our neighboring states. We can look at New York City right now. New York City is completely overwhelmed in the hospital, hundreds of patients in the hospital, not enough ventilators to keep these patients alive. It is a very scary situation. It's very real. This is not a make-believe virus. It's very real. It does not discriminate against political party or nationality. It doesn't discriminate at all. Anyone is susceptible. We do know those certain people are highly susceptible to be admitted, and that's usually those that are older, over 60, those that have certain diseases like heart disease, diabetes, hypertension, or even those that are immunosuppressed, but no one is immune. Even small babies, small kids, teenagers, young, otherwise healthy adults are being admitted or dying from this virus, so no one is immune. In fact, the scary part is that some studies are showing that the biggest group of people who are walking around with the virus who are asymptomatic are actually adults ages 20 to 29. In certain places in South Korea and China and Italy, there are studies that show 30% of our young adults are carrying the virus but do not know they're carrying the virus. So that means they're out in public, they're hanging out with their college buddies, they're hanging out with their friends, they're spending too much time at the store. They're meeting and socializing, not thinking they're sick, but they're spreading it to other people who are then spreading it to other people, okay? And so we really have to take precaution because this is not like many other viruses. It's very tricky. And so our goal is to really keep the stay-at-home measures to heart, to really listen to our governor and our secretary, to do our part, because at the end of the day, each family, each individual can make a difference to save lives. We really want to make sure that we're working really hard to push and educate everyone. No matter if you think you're sick, no matter if you think I'm so far away from New York City, that you can do a part right here to make a difference with your family and your citizens of North Carolina. One piece of advice I have is that if you think you are sick, so if you're having fever, you're coughing, you have a head cold, you don't know what's going on, you really want to call your medical office. So actually speak to your doctor or your nurse practitioner, PA's nurse, and really get advice on what to do. We're not asking people that are sick just to come into the doctor's office. That is not protocol right now during the epidemic. You want to call ahead and get some advice. A lot of us are doing telephone visits where we're actually speaking to you one-on-one over the phone. Because if you have more mild symptoms, we're actually trying to limit office testing and have patients to stay home and self-quarantine at home, to not go into the office and expose other well patients or our staff or the physicians, okay, in the office. Because there's no specific treatment right now for this virus. It's pretty much staying home, taking cough medicines or Tylenol, for instance. Of course, if you are quarantining at home and you think your symptoms are getting worse, they're progressing, you're short of breath, you do want to seek out medical advice again, because if you're short of breath, you would want to go to an emergency department. In general, if you're self-quarantining at home, you want to take appropriate measures if you live with other people in your home. That includes isolating yourself from others. So that means staying at least 6 feet away, but also trying to maybe stay in one room of the house and not walk around carrying your germs, the virus, elsewhere. Not touching on your refrigerator or using the same bathroom as someone else, but truly isolating yourself to really limit the transmission to another household member. Listen to your doctor. They will give you guidelines on how long you should quarantine at home, especially if you didn't get a test. If you got a test right now, the tests are taking 7 or 8 days to get the results back. So it's a little anxiety provoking sitting at home that long waiting for a test, but it's what we're doing right now. We're waiting on several tests, I know, for my office right now to come back, and patients are just being advised to stay at home until we know more. But we're asking everyone to do their part and to stay informed. I'm, as a Christian woman, I believe obviously in the power of prayer, and I'm asking everyone to pray for God's protection over our people, over our nation, over this country. But I do believe that faith without works is dead. And so we can't just pray and ask God to protect us or trust God and not do our part. God has given us science. He's given us medical doctors. He's given us these studies to help us as tools to help our people. He's given us science as a gift, basically, to help us navigate this world that we live in. We do not want to neglect and be completely unaware of what science is telling us, of how this virus spreads and how we can protect ourselves. So please, let's stay in prayer. Let's stay informed. Let's encourage folks to keep their distance from each other. And when you do go out and you are in public, make sure you're washing your hands and you're trying not to touch your face, and you're keeping your distance from that neighbor that's wanting to talk really close to you. You're just trying to remind people to do their part so we can try to flatten the curve, reduce how many cases that we'll see over the next few weeks here in North Carolina. Thank you, Tribal Chairman, for just inviting me to come and try to educate some of our people. And thank you for our people who are doing their part with social distancing and taking this serious.
Dr. Chamaine is just one of many Lumbee medical professionals. We're so blessed to have our own Lumbee people who can come and give us the truth about medicine and about their profession and what's good for the Lumbee people and the well-being of our people. So thank you, Dr. Chamaine, for coming today and explaining this to our people. I did want to make one announcement. Our powwow, our leadership has made a decision to postpone it to the fall, so we'll have more information on that forthcoming. So please continue to monitor reports that we're going to put out and information on the Lumbee Tribe Facebook page. We will post Governor Cooper's executive order. I have one as well, maybe a couple that we'll post. Stay at your strongholds. We talked about this last week. We're sitting here on the porch of the Lumbee house of Henry Berry Lowry, and this was their stronghold, his family's stronghold. Stay at your strongholds. And remember, President John F. Kennedy said a long time ago, it's not what your country can do for you, but what you could do for your country. We're in a situation here, it's not what the tribe can do for you, but what can you do for your tribe? And what you've heard from Dr. Chamaine is what we can do for our tribe right now. The elders, we talked about this before, if we lose elders through this pandemic, we will lose our oral history, we will lose the pure essence of who the Lumbee people are. So this is about protecting our elders. So please follow this advice. Please do what the governor's asking us to do. Please do what Dr. Chamaine is asking us to do. And in the end, we'll protect our elders, and we'll come out on the other end of this stronger than we ever have been as a people. God bless the Lumbee people, and may God bless America. Thank you.